We are going to get you caught up on the latest. Overnight, lawmakers finally reached a deal on that historic $2 trillion plan to boost the economy. It includes direct payments to American families, and a vote is set for later today. Meantime, 60% of all new cases of the coronavirus are here in the New York City area. So now health officials are asking anyone who's recently left or visited the region to self-quarantine for 14 days. Also this morning, the royal family has just announced that Prince Charles has tested positive. We will have a live report from London just ahead. But first, we begin our coverage. Overall, there are now more than 54,000 cases and 781 deaths here in the U.S. NBC's Tom Costello starts us off this morning. Hey, Tom, good morning.
Good morning. Yeah, it's skyrocketing. We're here in Maryland, where the governor has closed all non-essential businesses. So that could be everything from a barbershop, a nail salon, a tax office, bars, restaurants for takeout only here. This impact, economic impact nationwide, not to mention the travel industry, is really having a huge effect on the overall economy. The president eager to change that narrative and now wants to set an ambitious goal to get the country back to normal. Overnight on Capitol Hill, Senate leaders striking a deal, agreeing to a massive $2 trillion coronavirus stimulus package, the largest in U.S. history.
After days of intense discussions, the Senate has reached a bipartisan agreement.
This is not a moment of celebration, but one of necessity.
The deal, which must still be voted on by both the Senate and the House, includes $100 billion of relief funding for hospitals, $200 billion for domestic priorities like transportation, childcare, seniors, and veterans, $500 billion for major corporate loans, and a small business rescue package that's over $350 billion. The bill will also provide a one-time $1,200 check to Americans who make $75,000 a year or less. The Treasury Secretary says President Trump will absolutely sign it.
I've spoken to the president many times today, and he's very pleased with this legislation and the impact that this is going to have.
Meanwhile, the president hopes the country will be back up and running full steam ahead by Easter, just 2.5 weeks from now, despite repeated cautions from the nation's top health experts.
So I think Easter Sunday, and you'll have packed churches all over our country. I think it would be a beautiful time.
However, his own task force advisor, Dr. Anthony Fauci, says that deadline must be flexible.
On a literally day-by-day and week-by-week basis, you need to evaluate the feasibility of what you're trying to do.
Dr. Fauci adding there would not be a blanket recommendation for the entire country since cases vary from state to state. New York remains the biggest coronavirus hotspot, accounting for more than half of the country's cases and nearly a third of the deaths. The World Health Organization warns the U.S. has the potential to overtake Italy as the global epicenter of the coronavirus pandemic. The president also doubling down on the idea that economic instability caused by the virus could be worse than the pandemic itself.
You're going to have suicides by the thousands. You're going to have all sorts of things happen. You're going to have instability.
Meanwhile, some in the president's own party are pushing back on his efforts to jumpstart the nation's economy.
Leaving our hospital system, our healthcare system in shambles is not the way to grow our economy.
Tom, let's go back to this bill. I know the devil's in the details, but you talked about this $1,200 check for families. What other kind of relief is in there?
Yeah. So it's $1,200 actually per person. So if you have a couple making $150,000, then they would come away with $2,400, and then they would also get $500 per child. Now it phases out the higher your income is. So if you make $99,000, you cap out. If a couple's making, I think it's $198,000, they would also cap out. And this bill also does include assistance for lower income Americans. An earlier bill had not included them or phased them down dramatically. This one does not do that. So this is a check for nearly every American making under $99,000 for an individual, $198,000 per couple.
And Tom, real quickly, did they say how soon you might actually get this check?
They want to push this ASAP. The devil, as you know, is in the details and getting the government moving, but the idea is within weeks.
Okay, Tom Costello leading us off. Thank you. As mentioned, New York City is now the epicenter of this crisis in the U.S. And while drastic steps are being taken to deal with the surge of cases there, the governor is blasting the federal response to the outbreak. NBC's Gabe Gutierrez is outside the Javits Center, which is a big convention center in Manhattan, now being turned into a makeshift hospital. Gabe, good morning.
Savannah, good morning. The numbers here are staggering, doubling every 3 days. And as you mentioned, this is the city's main convention center, almost 2 million square feet, and it is now being converted into a 2,000-bed hospital complex to treat coronavirus patients, as medical centers elsewhere are stretched to the limit.
This morning, the coronavirus crisis in the nation's largest city is exploding.
We were looking at a freight train. We were now looking at a bullet train, because the numbers are going up that quickly.
New York now makes up more than half of all new cases in the U.S. The White House task force is urging anyone who's been in the metropolitan area recently and traveled elsewhere to self-isolate for 14 days.
It's disturbing. About 1 per 1,000 of these individuals are infected. That's about 8 to 10 times more than in other areas.
But a frustrated New York Governor Andrew Cuomo is intensifying his pleas for federal help.
FEMA says we're sending 400 ventilators. Really? What am I going to do with 400 ventilators when I need 30,000? You pick the 26,000 people who are going to die because you only sent 400 ventilators.
Cuomo says nearly 1 out of every 4 New York patients is in intensive care.
Where we are today, you will be in 3 weeks or 4 weeks.
Hours later, the vice president insisted help is on the way.
Over the next 24 hours, more than 4,000 additional ventilators will be delivered to New York State.
Cuomo is now requiring every New York hospital increase its capacity by 50% and try for 100%.
It will require stretching people to the limit.
Across the country, medical resources are also stretched thin. In Los Angeles County, where a Navy hospital ship should dock soon, authorities are investigating the death of a teenager who tested positive for COVID-19. Atlanta's mayor says the city's hospitals are near a breaking point. Louisiana's governor says they're desperate for supplies.
I'm Blaine Alexander on the famed Bourbon Street in New Orleans, and here in the city, cases of coronavirus are exploding. Now experts are pointing to a likely cause, Mardi Gras. It was just last month that more than 1 million people were all packed here in close proximity, a virtual breeding ground for the virus.
Now serious concerns for states like Florida, with young people still defying social distancing orders and a large elderly population.
I'm very worried that most states are still not taking this seriously enough and really haven't made a plan for how they're going to deal with a surge of COVID patients.
The city of Miami just issued a stay-at-home order, and here in New York, the White House Task Force Coordinator, Dr. Deborah Birx, believes that the virus spread so quickly in part because of subway riders touching contaminated surfaces. Savannah?
All right, Gabe Gutierrez, thank you so much. And now to a dramatic first-hand account of what doctors are facing right now. Dr. Craig Spencer was in West Africa during the Ebola outbreak there. He later contracted the virus himself. Well, now he's the director of global health emergency medicine at Columbia University Medical Center in New York. And his tweets yesterday about his life in the ER these last few days and weeks got a lot of notice. Here's one of them. Nearly everyone you see today is the same. We assume everyone is COVID-19. We wear gowns, goggles, and masks at every encounter all day. It's the only way to be safe. Where did all the heart attacks and appendicitis patients go? It's all COVID-19. Dr. Spencer, good morning.
Good morning, Savannah.
I'm so glad to have you here. I'm so glad to have your perspective. You're there. I imagine you're headed to the hospital in a few moments. Take us into what you're seeing right now. I think people see empty streets and they think, what's different? They're not seeing what you see every day.
Yeah, I noticed that the other morning when I was walking to work, the streets were empty. And as soon as I walked in, it was a completely different scenario. Everyone is gowned up in personal protective equipment. I've worked at the same place for 9 years. I know my colleagues, and to see them in goggles and masks, I just don't get used to it. It's really kind of crazy every time that I walk in. And as you mentioned, last week we were looking for the 1 or 2 coronavirus patients that might be in the ER. Now it's hard to find 1 or 2 patients that are not coronavirus. The increase is absolutely staggering. And we know that we're really at the beginning of this. Case numbers are increasing on a daily basis, and soon our hospitals are going to be overwhelmed.
And what are you seeing? How are these patients presenting? I mean, we know that according to the experts, 80% will have mild and moderate symptoms. You're seeing the most serious cases. Does it run the gamut? Are you seeing younger folks as well as elderly patients?
Yeah, absolutely. We are seeing everyone from every age group. Yeah, it seems like older patients with comorbidities, with things like high blood pressure and diabetes, seem to be hit harder. But some of my sicker patients have been in their 30s or their 40s. Some of the people that we've been putting on their breathing tube, have been my same age. So the burden is certainly on older populations, but it does not spare anyone. And being in your 30s or being in your 40s or even being in your 20s does not exempt you from having severe complications from coronavirus. So it's important that everyone understands why we're doing this and why social distancing is so important, because without it, we're just going to spread this further in our population from New York to Newark to New Mexico, everywhere around the country.
Are you worried about the amount of ventilators that you have in your hospital, the respirators, the masks, the personal protective equipment? Are you worried there's not enough?
Absolutely. Everyone's worried about that. At the rate that we're putting people on ventilators, at some hospitals 1 to 2 per hour, the simple math shows that it's only a matter of time until we run out. We need more ventilators now. My friends working in emergency rooms all throughout the city are talking about restrictions on the amount of personal protective equipment that they can wear, being asked to reuse N95 respirators. Those are the thicker, more resilient masks that help filter out the virus. And the reason that I've said in many ways this coronavirus pandemic is worse than working in West Africa during Ebola is because I never once worry about my personal protective equipment in West Africa. This virus, unfortunately, is perfect in the sense that it spreads really, really well. It gets all age groups. It's just really scary, the potential this virus has. We've already seen it in China, we've seen it in Italy, we've seen it in New York, and I think we'll see it throughout the rest of the country unless we act now.
I was so struck by your tweet. You said you might hear people saying it isn't real. It is. You might hear people saying it isn't bad. It is. You might hear people saying it can't take you down. It can. I survived Ebola. I fear COVID-19. What's the message you want to say to people who are watching in the few seconds we have left, Doctor?
I think what's important is to take this very seriously. It does not exempt anyone. Everyone can be impacted by this virus. What we're seeing in the emergency room right now is dire. It's only a matter of time before this spills out onto the streets. Please stay home. Please protect yourself. Please protect your healthcare providers. We need everyone to do their part, and we will get through this. It will take some time, but we will be over this just right now. We need everyone's assistance in trying to save as many lives as possible.
Dr. Spencer, thank you for taking a few of your precious moments that you probably want to be with your family to share this message. And please do us a favor and give our love and thanks to everyone you work with at the hospital. We really appreciate it.
I will. Thank you.
Okay. Hoda, back to you.
All right, Savannah, thank you. Now to breaking news just out this morning from the royal family. Prince Charles now testing positive for the coronavirus. Today, senior international correspondent Keir Simmons in London with the very latest on this. Keir, what do you know?
Hey, Hoda, good morning. Well, we're just getting this news. Prince Charles, 71 years old, in Scotland, now self-isolating, including, it appears, from his wife. This statement from his office: the Prince of Wales has tested positive for coronavirus. He's been displaying mild symptoms, but otherwise remains in good health and has been working from home throughout the last few days as usual. The Duchess of Cornwall, that's Camilla, of course, has also been tested, but does not have the virus. Now, we know that Prince Charles met with Prince Albert of Monaco also earlier this month, who has himself tested positive for coronavirus. But that statement from Prince Charles's office also saying it is not possible to ascertain from whom the prince caught the virus, owing to the high number of engagements he carried out in his public role during recent weeks. That, Hoda, of course, raises the question, who might he have given it to? We know that he hasn't been shaking people's hands, but of course, the Prince of Wales meets many high-profile people. The Queen, 93 years old, Buckingham Palace, saying in a statement, the Queen remains in good health. The Queen last saw the Prince of Wales briefly on the morning of the 12th of March and is following all the appropriate advice with regard to her welfare. But, Hoda, you know, this just underscores what we have been saying, that this virus has no regard for class or race, Hoda.
With Prince Charles kind of being in isolation and the Queen as well, does that mean that Prince William has to step up and just take on more responsibility?
He's been doing that already, Hoda, in many ways. You know, this family is adept at adapting. But, of course, this country, already shaken, is going to be shaken by this further news. We just hope and wait for more news. Good news that Prince Charles seems to be simply having mild symptoms. But again, for the royal family, going through what so many families around the world, including over there, are going through.
All right, Keir, we appreciate you. Thanks for updating us. Let's take a break now, get a first check of the weather. We're going to check in with Mr. Roker. Got some storms overnight to talk about. Hey, Al.
Hey, Hoda, thanks so much. Yeah, we had a tornado touchdown, Tishomingo County in Mississippi. You can see this is a storm chaser. Boom. His vehicle gets hit by trees and wires from that tornado. Fortunately, no injuries being reported. There's some damage throughout there, but the good news is that is moving through. As we take a look at the radar, you'll see that we are watching these showers and thunderstorms now push off the coast. That's the good news. We are going to be looking at more wet weather making its way up into the northeast, and as it does, we will start to see a little bit of light snow through Pennsylvania as that pushes on in. We expect also to see more wet weather in the northeast, maybe about an inch or two at the most as this system moves off.